Welcome to Alcohol Abuse Treatment and Rehab Facts. I'm Dr. Suka, the real cause of treatment and addictions. Science and medicine now agree that all addictions, that's all addictions, are due to an imbalance of brain chemistry. It's called or known as a reward deficiency. Now, most people acquire a reward deficiency at birth. It's an inherited genetic programming. However, reward deficiency can be acquired through one's life if they have an overbalance or growth of yeast and intestinal bacteria, exposure to molds, toxins, and chemicals. And many people are actually allergic to the grains that make up their alcohol. A hormonal balance can affect the reward deficiency, that is the brain chemistry, and malnutrition, which is rampant throughout this country and is leading to the high levels of diabetes and heart problems and obesity. This is creating a reward deficiency. Substance abuse, people who weren't born with a reward deficiency, but who abuse it constantly and regularly, can actually create a reward deficiency. No shame, no blame, and no guilt should be attached to addiction. Addictions are not due to poor parenting or poor environments or lack of education. They're not due to character defects, moral shortcomings, or lack of willpower. People have lots of willpower and still aren't able to overcome their addiction. Addictions are not due to choice. Why is the relapse rate so high, 82 to 95%? Let's talk about sobriety. Sobriety is not recovery. The very statements, easy does it, I'm white knuckling it, one day at a time, indicate that the person hasn't recovered. And people who give up their alcohol generally trade that alcohol for other substances. They use sugar and junk food and caffeine to get that reward that they're missing. If they continue to smoke or chew tobacco or use marijuana, almost in 100% of cases, these people will relapse back to alcohol and not understand that it was because they didn't stop the addiction. They just traded their addiction. Sobriety, for many people, means maintaining what's called dry drunk behaviors. Anger outbursts, irritability, attempting to control the environment or control the behavior of other people. They may remain secretive. They aren't real in their presentation of how they are with other people. They may be impulsive, as they always have been. So again, why is the relapse rate so high? Because the brain chemistry, the underlying cause of the addiction, hasn't been repaired. Just saying no to drugs doesn't work. We need to stop just saying no to drugs. Recovery means no cravings, no insomnia, no anxiety, no depression, no relapse. These are the reasons why people relapse. So recovery means we don't have these issues. So how do we recover? Well, option number 1, talk and 12 steps, group support, individual therapy, family therapy, group therapy. We all know they don't stop the cravings and they don't prevent relapse. Option number 2 is medications. Well, it's true, medications can remove your symptoms temporarily, but what about the side effects? Groggy, unable to think, sleepy, not motivated, not having high energy, and what about the constipation and the diarrhea and the dry mouth, and what about the desire to overeat? All of these symptoms are a sign of the fact that these medications aren't working very well. What's important to know is that all of these medications are also addictive, so it's trading one addiction for another. And getting off some of these medications can be worse than getting off of the alcohol. But perhaps the biggest thing behind medications is that they distort the brain chemistry even more. They don't repair it, they distort it. So option number 3, let's remove the underlying cause. That sounds pretty commonsensical, doesn't it? Let's rebalance dysfunctional brain chemistry. We do it with the substances that the brain is made of, which is amino acids, vitamins, minerals, healthy eating. The brain requires, because it's imbalanced, requires large amounts of targeted, specific amino acids and vitamins and minerals to rebalance itself. But it's done naturally with no medications. Does that sound too simple? Just healthy nutrition? Well, it's more than healthy nutrition. It's targeted formulas to rebalance the brain chemistry. Have you tried it? The results are up to 85% recovery rates when people use this method of recovery. So, what's your choice? Recovery or sobriety? It's never too late. For more information, go to arisealcoholrecovery.com or call us at 417-380-3254. We're here to help you.